Hi, I'm Terrence Kommal. Over the last few weeks, many of you have watched me ponder, deliberate, and get into exact details on numbers, Omicron, the variants, the details, the data, and potentially some of the motivations on what my colleagues and I had called bad signs and potentially creating early panic. And I still stand by those exact concerns from a scientific perspective. But what I do want to deliberate now on are three very important things that's outside of the technicalities of the scientific disagreements or perspectives or the exact details and numbers. Let's for a moment reflect on what we know and what I do believe is important. One, there are significant risks, irrelevant of the variant, of you contracting COVID and potentially having serious consequences as a result of a COVID virus infection for yourself or vulnerable family members and friends and near and dear ones that you're spending time with now in this festive series and now as Christmas being around the corner. It is important for you to be aware that you may not be at risk, but others around you may be at risk, and you may potentially be a carrier or contract the virus from them in these festive times in which often many of us lower our guards, socially distance, of course, far less, sanitize not as often as possible, and reduce wearing our masks, which all three, I think, are bad decisions or poor decisions, but are realistic human decisions because you do need to engage and be with family and friends. But all I ask is be responsible and where possible, where realistically possible, please ensure you comply with the local laws and regulations and wear your masks where absolutely available and absolutely possible, because it's necessary to reduce not only you sharing what you could potentially be carrying, but also contracting infections from other people. That's one in terms of what we can control. Two, the stuff that we are aware of, and a lot of people speak of complexities of people developing significant diseases, both before having vaccines or after vaccinations. Let's be realistic about this. If someone had an adverse reaction to a vaccine, it's most likely that that individual also could have an adverse reaction to the actual COVID-19 infection, which is realistic. Because the fact that you simulate an infection to your body, irrelevant of the form or the type of vaccine you've taken, means your body is predisposed to an aggressive reaction. And what we can control in that space is being aware of our pre-existing healthcare concerns and comorbidities. These include optimizing your treatment for diabetes, hypertension, thyroid dysfunction, and any other medical conditions that you're aware of, and optimizing your treatment so that your body can be in an optimal state, not a heightened state of stress at the time that you potentially could be exposed to the COVID infection. And it is important you do so because you can't control whether you get the infection at some point because of the transmissibility, whether it's the Omicron variant or not, of any variant, but it be the COVID-19 infection. What you can control is optimizing as much of what's in your control of medical care, reducing your risks, not consuming too much alcohol, if any at all, and having healthy diets and enough rest, even in these festive periods. Because if your body is at a heightened stress perspective or heightened stress state, its immune response will also be affected, as well as your state of mind and general well-being, if and when you do get infected. And those are important things that you can control. The third that you can control, and yes, there are people who have a perspective and view and significant concerns on vaccines, whether they work, don't work, whether it's a try to control the world approach, whether it's profiteering. I have no interest in any of the other reasons behind that, except for what I know from the science and the healthcare perspective. If somebody chooses not to get one, I respect their view, but I do not necessarily have to agree with that. What I do believe, and this is my view based on the information that I had, and you're entitled to disagree, which is fine. I believe, and so do many in the medical world and healthcare world around the world, that vaccines reduce significant mortality and serious disease. That means it reduces people dying. It reduces the number of people that have serious disease. And we can see this from the number of cases being admitted in different hospitals. We can see this based on the number of people that have been vaccinated now after the Delta wave and now in the Omicron wave. And we can draw inferences. We don't have enough data to work on it, but based on what we know at this point, I'm confident enough to draw enough inferences to say that yes, there are some who saying that some there's some potential of immune escape and some parts of the vaccine not working. That's realistically impossible, but not in everyone, because each person's immune response is individualized. And what you can control is at least pre-exposing your body to the vaccine, which allows your body to build a innate immunity and memory. And when I say immunity, it means an immune response, not that you can't get COVID. So when we talk about that, it is for a finite period at least that we know to the stage that your body's pre-ready and pre-exposed, knowing how to deal with a potential real infection of the COVID virus. That's important because at least your body is ready and it knows what to do with this infection. You know how to care for that. So if you can control these three things, you see three important things: your social decisions and social behavior, you can control optimizing your choices in terms of pre-existing potential healthcare concerns and conditions, as well as reducing alcohol and other stimulants that may affect your immune system. And thirdly, consider most likely and take the vaccines. And where possible, if boosters are available, I don't see any harm in taking a booster, although there are questions around of why one should. At this stage, as in my personal and professional view, I do believe there's great value in taking a booster because it reignites and re-stimulates your immune response so that it means your body's at least primed to some extent to a potential infection. And that can give you a greater fighting chance if and when you do get a real infection. And I think that's important. There are many who are saying, well, there are conspiracy theories and there are concerns and there are off-label uses of medications. I don't dispute that they may or may not work. I do know of a lot of Ayurvedic treatments that are being done, a lot of herbal treatments that are being done. Some people are using CBD products and others, and I don't dispute they work. And if they work and you have enough faith in them, I'm not saying to take them or not to take them. All I'm saying is be considerate of everyone in these times. Many have lost near and dear loved ones in this period. Just yesterday, I spoke to a close friend whose brother was diagnosed with COVID a day prior. And by 3 a.m. the next day, he was gone. These are realities that you deal with. Last festive period, last year this time, we lost my grandmother. I lost my dad last year. We all are in this together. COVID is significant. COVID is affecting every family. But as I've said in previous discussions, in the Sanskrit phrase of Vasudhaiva Kutumbakam, the world is one family. We're in this as human beings. We're in this as a global family. We're fighting a virus and an infection that is impacting everyone's lives directly and indirectly from a healthcare perspective. It's significantly affecting our ability to travel and live normal, as we called it in the old days, as well as the social and economic impact that is significant. And I empathize with everyone affected by that. But if we can focus on these three key areas of making good social decisions, making good decisions on optimizing pre-existing healthcare problems, as well as actively vaccinating and where possible taking booster vaccines, then I do believe you and I will have a much better chance to fight off this pandemic and something that's now almost becoming endemic. As we're seeing, the numbers of cases that are serious are reducing, but it does not mean we must lower our guard. It means we must continue to be responsible. And I thank you for all you've done. Again, I wish you and your family well.